The repeal and the other actions that the Senate are talking about could take us up to 32 million people losing their access to health care and health insurance. Really a monstrosity. But as the Democratic leader, Mr. Schumer, said on the floor today, we look forward to a time when we can go forward. I don't know if he said that, but how we go forward would be that we have to recognize we cannot eliminate the taxes on the high end. We cannot cut Medicaid, and we must do this under the regular order. But first, the Republicans in the Senate have to complete their business. If their next order of business is to repeal the Affordable Care Act, I doubt they would have the votes to take that up, but let's see. And as soon as that's finished, of course, we have stood ready from the first day the president became president to extend a hand of friendship to talk about how we can improve and update the Affordable Care Act and stand ready to do so as soon as the Senate decides that it's finished with its business. Yeah?
Leader Pelosi,
yes, ma'am.
Given that they've targeted you as, their enemy, the Republican Party,
Yeah.
what are the chances of Republicans actually allowing Democrats to work with them on health care?
Well, I would hope so. It's about the American people. Your question as to what would they do to allow us. The president in a statement said today his health care proposals were defeated because he didn't have the cooperation of any of the Democrats and some of the Republicans. No, he has never really been about increasing access, lowering cost, improving benefits. That's what the Affordable Care Act is about. So the reason the Republicans in the leadership in the Senate have found themselves in the situation there is because people have spoken out. Nothing is more eloquent to a member of Congress than the voice of his or her own constituents. We all know that. The town halls worked. The outside groups weighed in with not political organizing, but with the storytelling of people and what the Affordable Care Act means in their lives and what taking it away would do to the health and well-being of their families, what their assault on Medicaid means to the good health of our country. So it's not about them and us. That's inside maneuvering. It's about the outside message and mobilization from so many people calling their senators and their members of the House and saying, listen to my story. And as I said yesterday at one of the filibusters on the lawn outside the Capitol, we believe that there's some goodness in the hearts of our Republican colleagues. Otherwise, we wouldn't be telling these stories. Hopefully it will be falling on fertile territory where people will listen, will learn. And when they know, they will care about what their monstrosity of mean legislation means in the lives of the American people.